like an advertising slot in IPL to an extent, right? So they get like a few seconds in front of the doctor when they go for the detailing call. So what are the things that you have seen really work in detailing, especially when they get very little time with the doctor? Or I understand one point is about the rule of three, where the focus is really there. But what have you seen really working there in terms of communication?
Actually, a lot of people think that it is the good communication with the doctors is the most important aspect. It's real world is slightly different. First of all, the most important aspect is developing a good rapport with the doctor. A representative, unless and until he develops a good rapport with the doctor, a positive rapport with the doctor receives him very, politely, nicely, and positively, and is ready to listen to what he has come to say. Till that platform, if it is not built, so whatever communication, etc., that will be very momentary, and it is not very impactful.
Hello everyone, welcome to GamePlan 2023, Sharpsell's leadership video series on what it takes to run sales and marketing and the best practice around sales from the stalwarts of the industry. Today we have Mr. Rajendra Mehta, the Director of Sales and Marketing at Glowderma. 35 years of experience in running sales and marketing organizations in Pharma, spent more than a decade with Glowderma. Launched a lot of new products, knows what it takes to run large organizations and run large sales machinery. So I think this, hopefully we learn a lot from him, and then we could apply some of those insights as we go forward. Rajendra ji, great to have you here. Welcome on board. Welcome to GamePlan 2020.
It's my pleasure. It's a pleasure, really.
One of the things when we think about Glowderma is you have a niche segment where you focus predominantly on skincare and dermatologists. So and as you explained, I think there's this strong focus on chemical-free natural products that are good from a long-term perspective. So what does it really take for people on the ground to really communicate this message? Because I think it's extremely important that they communicate both the importance of the kind of products which are chemical free, and also ensure that either both the HCPs and the customers really get it. So how do you ensure that they actually are able to communicate that well?
See, first of all, when we are designing the products, at the time we do a lot of benchmarkings. Then we try to understand what are the needs. And based on the needs, besides fulfilling the needs, what are the problems also which other brands tend to have? We do deep surveys with the doctors, and after that we start the designing process. So our benchmarks get set during that time, and then we come out with the product, and again the product is given for some initial trials. We ourselves use those products, and all those kind of a dip sticking is done. And then we are satisfied totally, yes, the product is not only working good, but the product is really safe also. Then we go for the marketing of the brand. So this is what we have done with each and every product that we market. It's our usual process. For a lot of people, it may look like as if it is a very difficult process, but for us, this is the only process. So now what has happened is that whenever a doctor prescribes a Glowderma product and a patient has taken because of the doctor's prescription, generally they find the product are really good, they work very well, and they are quite safe because patients tend to use for a longer period. And that's the reason they stick with our products for very, very long periods. And so many times we see nowadays on YouTube also, we have seen a lot of patients putting their own videos that I've been using this Glowderma product, this product Moist, our moisturizer, and I found it is really good, extremely better, much better than a lot of products. Then initially when we talked and sent our message to the healthcare professionals, dermatologists, that this is the distinct way in which we have designed our products. These are the unique propositions, unique selling features of our products. Initially they heard. But when they started prescribing and when they heard from the patients, then their confidence and their trust in us grew by leaps and bounds. And today that is the reason that almost every top dermatologist of the country recognizes and mentions and recommends, and also so many times they advocate also that Glowderma products are unique and they are really good. So this is probably the best victory that we can have when our customers, that is our doctors, as well as our users, that is patients, both of them are really happy with our products and they express their wow feeling with our brands.
Yeah, I think the end users actually coming up and speaking about the product is rare, and because there is this tendency to not talk about a product when it's really good, and if it's people tend to comment more when things don't go really well. So I think I think doing that, and then the doctors actually recognizing this, that the end users really love the product, I think that's a phenomenal achievement.
Thank you. Yes, but that is the way that we have developed ourselves.
Wanted to ask you one question on that. So one of the things that we hear when we speak to business leaders is the perceived gap between what the marketing wants to communicate and what the salespeople end up communicating. Because marketing puts in all the effort in terms of the brand communication and so on and so on. And at the end of the day, that communication has to be carried by each person on the ground when they meet, let's say, their customers and doctors and so on and so on. How do you ensure that every salesperson on the ground is able to carry the same message? How did you see that happen?
See, the problem is always, what we want our team to do and what they tend to do. Yes, so many times there are changes, there are differences. So, first of all, we have to explain very clearly that what is our products all about, what the company is standing for, what our brands are actually, what visions the brands were designed. Then we come out with few important messages. We give them scientific training, technical part of the brand's training. Then we communicate and give them the material to go and give to the doctors. So what happens is that, number one thing is that we have to continuously maintain the continuity and keep telling them again and again that this is what you need to do, this is what you need to do, this is what you need to do. So this process is relentless and this process is infinite and never ending. So what you say and what you believe, then you observe that people are doing only some part of that, then again you talk, again you tell them, again you make them do some improvement. So this is a basically relentless and never ending. You never achieve 100%. The reason is what you have told and what people have understood, because their own minds are also at work. And the ideal situation in which we create the material, though sometimes we tend to keep some of the things, but ultimately the actual ideal situations don't exist in doctor's chamber.
True.
Because you have designed a product where there is a 3-minute talk, then there is another brand 3-minute talk. If actually the folder which we give to our people, if they really decide to detail, it will take around 15 to 20 minutes. Now no doctor gives them so much of time. So the ground realities become very, very different. Net practice is different and the pitch is behaving in a very different manner. So then we have to teach our people continuously the important messages, that at least those important messages are communicated. So what you do is that you make a material of say 1 page, out of that 3 important sentences, and out of these 3 important sentences, 3 different important messages. And these are the ways that things need to be communicated. So this is how we tend to get our people across on our side so that they communicate in a proper manner. Then we have different kind of trainings for the representatives, for our managers, and we keep meeting, we keep reviewing the sales process, and then again same messages are getting passed again and again. So that is how we try to achieve that in that 10 seconds, sometimes 30 seconds, sometimes 1 minute doctor call, the important brands, the important messages are communicated properly.
One question that I wanted to ask you was, over the last, let's say, 10 years, how did you see the role of MR change? What are the things that kind of stayed the same, constant, and what are the things that really changed?
I'll go back to the historical times of pharma industry, before early 70s, before 70s. Before 70s time, the pharmaceutical representative was considered extremely knowledgeable and he was an extremely respectable figure even to the doctors. And earlier time, they used to have big, large territories. Like, one fellow going from entire South Gujarat, Baroda to Vapi, like that. And today we may have 15 people within that point. So one person covering that. And they used to travel into first AC coaches with certain trains. And doctors used to come and meet them. All those things used to happen during those times. Then the times changed. In 70s, more people came into the field and more companies started coming into the picture. Earlier era was dominated by multinationals. Then the Indian companies started improving themselves, came very aggressively. So now the doctors remain stationary and people started meeting them. Slowly things evolved further. Then divisionalizations happened, therapeutic divisionalizations. Cardiovascular, you have one therapy, one team who's going to talk only the cardio-diabetic products. One is only ortho. Then based on the therapies, therapeutic segments, the team started getting divided. And some companies specialized into some therapies, some companies started specializing into other therapies. Then some mega, corporations started getting built up in India. So all these companies have some 20-30 divisions within their umbrella, and for each division they have separate field force. So based on the speciality of the doctors, the field force is meeting them. Now what happened is that at the customer level, at the general level, suppose there is a doctor who is a physician. Now that doctor is being met by the cardio-diabeto man, the general vitamin segment man, the cough syrup man, antibiotic man, and all those. So number of people meeting the doctor started increasing to the level that nowadays an average doctor must be meeting not less than 250 to 300 representatives, or even maybe more. So what happened is that it started interfering their own practicing times. So they started putting some barriers, started creating difficult barriers. Some doctor is meeting only in morning, somebody in the evening, somebody on first Monday, second Monday, somebody you have to give the cards 10 hours before, then you have to wait for 2 hours, 3 hours, and all those kind of structures, barrier structures. Then the customer started increasing. So you had to cross those hurdles to meet the doctors. So all these things started becoming that. And now the therapy started becoming important. Domination in the therapy. Earlier it was the volumes. Now it is the therapeutic domination. Now within therapies also, sub-therapeutic dominations also started happening. So all these developments are happened. Now classically speaking, if you go to a big company, even within dermatology, they will have 3 to 4 divisions. 500 people in each of them. So one is a aesthetic segment, second is a steroid segment, third is a moisturizer plus other brand segment, fourth is a therapy like vitiligo is another sector. All those ways. So even dermatology also started getting divided. Same happened with the cardiovascular sections also. Interventional cardiology, then the second cardiology, then third cardiology. Number of brands with each companies. Now on average, a big company has not less than 3 to 500 brands. More than 500 brands, maybe some of the companies. So this started happening. So therefore needs how to meet a doctor from different divisions. So same doctor, how to extract more from the doctor. So there is one division of aesthetics, one division is another molecule, one division another molecule. So from the multi-pronged approach to the same specialty, same company, so many divisions. So all this have happened now. So this is a world which we saw earlier times, and the world we see now has changed enormously.
In this scenario, what are the some things that you have observed, the characteristics and the behaviors that separate the great sales, the great MRs from the average ones?
Great MRs are the guys who are very much well prepared about their products. They know the basics about the products. They know about the product and the problems, the diseases. They know about their brands. What is the ingredients of my brand? What are the USPs of my brand? So these are the people, first of all, is very well prepared. Most of the best MRs which I have seen, they are very well prepared. That is one. Second point is that they do their homework very nicely. Before going to the doctor, they will try to understand what the doctor has prescribed, how much doctor has prescribed, and probably try to learn that where doctor might have prescribed. And they measure up their success or what needs to be done based on that. So their groundwork, their homework is much better compared to other people. So when they enter the doctor's chamber, they are very well prepared about themselves, their company, and their brands. And they are very clear that what I have come to achieve today, what brand I am going to talk today, how much I am going to ask the doctor, request, something like that. So these people are first of all very well prepared. That is one part. Second is that they enter with the clarity that what I am going to achieve in this call. But before that, they had developed good rapport with the doctors. They focus a lot of time into meeting doctors on regular basis, talking proper way, judging the doctor's moods, situations. So they have a very positive, perception about themselves, which helps them in doing all this in the doctor's chamber in a proper manner. So these three elements, what I have seen, these great guys, they need not be the best communicators. They need not be the smartest looking guys. They are the people who are very, very honest and dedicated about their job. And the doctor also likes the dedication and the sincerity much more than the smartness. They will appreciate a representative who is coming exactly on time to meet them and fulfilling whatever queries they have about the brand, whatever basic things they want to learn about the product. And this man is able to answer and satisfy all that. And the man is truthful. So sincerity, honesty and truthfulness is the most respected quality by the doctor, the MRs. And based on the regularity of the person coming, the representation of the company, all these factors get added. And this is what I think separates the great MRs to the normal, usual MRs. And these are the people. Another aspect is, doctors like stability. They want to see a MR coming from a company for a long period. They don't want to see a man with one company today, another company tomorrow. They're more comfortable with good people and with the longer running people. So, and they appreciate that part, that this man is stable in the company, so they value that part more. And they also like and appreciate the company who is able to keep the people for a longer period. So all these things create good positive perceptions. Besides that, they want nowadays, all the important doctors want that not only MRs, but the managers also keep coming and visiting them regularly. They want to see the interest of the company in them is really maintained or not. And if there is something new, they also want to learn what is new things happening. Because a lot of things are very repetitive. Same products, 25 companies. So in case if there is any distinctness, if there is any really differentiating factors, they're always eager to learn about those things.
So, as an organization, what does it take to replicate these behaviors across the full sales force? What are the things that we could do to kind of ensure that most of our folks are able to do this?
See, it is the company's mindset. Like in our company, we do a lot of things in a very distinct manner, different manner. I'll give you a few examples. Like when we design the product, the first differentiation is created then and there. There is always some innovation, some new technology, some new differentiating factors built in every product. So we start from that part. So there is a differentiation built in, not after the product is introduced, but before the product is conceived. So differentiation is created before the product is even conceived or designed. So the differentiation is created well before the product, number one. And based on those differentiating points, the brand is then put for the final test. So we are very clear that these differentiations we have created. Now our next role is to educate our teammates that how our brand is different from other brands. What innovative technology we have built in this brand, what innovative ingredients we have put into this product, how our product is going to behave differently. Now this is the training part, educating them continuously again and again. And after that, we keep asking our teammates also what you have been communicating to doctors. We work with them also and we see that what they have communicated to doctors, what the doctors have understood. We take some surveys also, sometimes through interviews, sometimes by some questionnaires also. So all this are the part of the process. But during these periods, we do some of the product launches in a different manner. Glowderma has developed a different culture of introducing the products to the doctors. I will not reveal much details about that. Then our teammates also, the way we treat them. For example, during the COVID time, almost all the companies started cutting the salaries. Now we were among the few companies who never deducted even one single rupee from anybody's salary. Not only that, we gave them their expenses before. Expense, they are sitting at home, they are not incurring any expenses. But we gave them expenses in advance because their houses have to run. All those expenses should be taken care of. So this is a unique way in which we approach our people also.
Got it.
And
respect that.
Yeah, all this type of things which we do, that's why probably we get very good respect, not only from doctors and chemists and our stockists, but our people. So we have a lot of unique ways in which we operate every part of our operations. That's the interesting part.
So at Sharpsell, we speak a lot about sales playbooks.
Yeah.
So Rajendra ji, when you hear the word sales playbook, what comes to your mind? What are the thoughts? What do you think about the word sales playbook?
A typical sales playbook, when I hear the word, that is my take onto this. That is something like that. A representative goes before the doctor's chamber. He is sitting. He might have gone to a chemist, or most of the times they don't go also. In spite of, it all depends on the way situations. So generally, they will go to the chemist before entering the doctor's chamber. Then they will wait at the doctor's chamber. And while they are waiting, there is a chat, spending the time, so many times roaming, wandering here and there, sometimes just sitting, looking at the social media nowadays. That's very important part. And all those things, and then they enter the doctor's chamber. And there is a very limited time based on the situation. They have to just take out their folder, talk to doctors, 2, 3 brands, 5 brands, sometimes 15, 20, 30, whatever it is, discuss, and then thank the doctor, request the doctors, give samples. Nowadays, we have stopped giving samples to the doctors. So all those things is the usual playbook. Some prescription comes, some good flow of brands or the brand starting happens. Then our people go back to the doctor, they thank you, etc. Then they do their birthday celebrations, important doctors. Sometimes marriage anniversary, they go and wish them. Sometimes special doctor days, etc. They go and visit them very personally. So all these are the usual sales playbook.
What are your hobbies? What do you do to relax?
I am a voracious reader of any material in the world. It's any topic, anything. So I always have something or the other to read about. Either some book. Nowadays books have reduced because you don't get too much of time. Traveling, etc. also takes huge time. But whenever I get a chance, I'm reading. Newspaper, magazines, then nowadays mobile phone, newspapers within them. Then go to some other website, try to learn as much. Our scientific things also, whenever I get a chance. So I'm a reader, basically, voracious reader. And try to acquire knowledge from every source, whatever is that. So that is one part.
Brilliant.
Second is that I like to do some exercisings. Nowadays, I have started playing squash. Squash is a very power game.
Wow.
So this was my college time hobby and my, I should say, desire. So now I'm completing my desire of playing squash. I'm learning actually.
Brilliant.
And yes, traveling. In traveling, I like to meet people, different places, different people. So that new things, new places always interest me. So these are my basically, and music, of course. I'm a classical music listener, classical music Indian especially, and the ghazals. These are my usual liking. Sometimes Western music also, and in Western music it is heavy metal. Heavy metal. It's not the softest.
Softer
The
side.
heavy metal to Indian classical. That's my range.
The complete range is there.
Yeah.
Brilliant. So, what's your favorite quote? One quote that kind of stayed with you for long.
Why walk when you can run?
Wow, brilliant. Awesome. And if you have to give one advice to an aspiring sales and marketing leader who's in the early stage of the career, what would that be?
This message I have been giving to my team. The day you get taken or get elected, selected for one position, that very day you have to start working for the next position. You don't work for the position in which you are. You always work for the next position.
Next position.
The moment you get the next position, same day you have to start working for the next position. The challenge should always be to go ahead, and challenge is always to not do for today but for tomorrow. Then this entire work becomes enjoyable and it becomes challenging. And it is the challenges which make it more enjoyable. If you don't have challenge, if you don't have a bigger, vision for yourself, you will stagnate. So that is my message. If you are a MR, on the day you have been taken by the company, work for the next position. Simple.
Got it.
It's a pleasure really to interact with the Sharpsell co-founder. I have a lot of respect for the Sharpsell. And let me speak few words about Sharpsell also. I think that will be very befitting. When we met and saw the presentation for the first time, there at Pharma Future conference which happened, I was taken by that. Right from that moment, it was a love at first sight for what Sharpsell stood for. And I made it very clear to Abhijit. I think he was the first man who met us. I said, I am in for it, 100%. There's no ambiguity. I would like to bring it to my teammates, to make them better, to make them more effective, and to make their work more enjoyable and learningful. I had made it very clear, no matter what, but we'll get Sharpsell to our teammates. So I must say that what Sharpsell has thought, conceived, the way this application has been designed, it is so nice, it is so easy for the salespeople to use it, and it is going to be so much of knowledge imparting to them with the help of technology, of course. And it is 24/7, anywhere, anytime. People can learn and improve themselves. Then they can gather their thoughts, articulate their communication very crisply and clearly. In fact, we were looking for something like this in a different manner, but now it has come with the advancement of technology in such a handy manner. So that is what we have done ultimately.
Thanks
We have
a lot
gone
for that. I think.
Sharpsell. Now you see the implementation is going on, and soon it will be in the hand of our people. And I am very thrilled and excited to see how my people make the best use of it, and they do our job, our vision for our company's development in a very clear manner in Doctor's Check.
We hope to contribute to that, and we will keep learning and then keep improving.
And I must thank Sharpsell for conceiving such very important and very, there was a big gap in that. This is an extension of the learning modules. What we see is the classical learning modules. They don't suit for this need for a man who is in field and going to meet a doctor. That need you have fulfilled. So I must thank you for that. This has brought a lot of improvement for our peoples, and it is satisfying a need which was always existing in pharma industry.
Thank you. Thank you, sir. Thank you. Pleasure meeting you. I'll hopefully see you soon in Mumbai.
Yes.
Have a nice day. Thank you.
Yeah, and together we will be able to grow not only Sharpsell but Glowderma also, and
We
take
will do
both
that.
of the companies to newer heights.
We will celebrate the next 20 years together.
Yes. It will be our pleasure.
Thank you. Thanks a lot, Rajendra ji.
It's a pleasure meeting you, Mr. Hanuman. It's a pleasure.
Pleasure meeting you, sir. Pleasure. Thank you.
Thank you so much.